Have you ever received an urgent call claiming your recent eye exam revealed a torn retina requiring immediate surgery? Dorothy Mitchell, a 79-year-old retired teacher from Seattle, Washington, who had been experiencing minor vision changes, thought she was saving her sight when ophthalmologists called about emergency retinal surgery. Within 48 hours, she had paid $18,000 for fake eye surgery that could have caused permanent blindness. Dorothy's story reveals how medical scammers target seniors with vision concerns, using their fear of blindness as the ultimate manipulation tool. By the end of this video, you'll understand exactly how these fake eye specialists operate and learn the warning signs that could protect elderly patients from vision-threatening fraud. Stay until the end, because Dorothy's experience shows how fake medical procedures can cause actual eye damage while stealing money, making these scams among the most dangerous healthcare frauds targeting seniors. It was a Tuesday morning in June when Dorothy's phone rang with a call that would exploit her deepest fear about aging. She had just finished her morning coffee when her caller ID showed what appeared to be an ophthalmology clinic number. Mrs. Mitchell? This is Dr. Rebecca Thompson from Advanced Retinal Associates. I'm calling about urgent findings from your recent comprehensive eye examination that show critical retinal damage requiring immediate surgical intervention. Dorothy felt confused and frightened. She hadn't had a recent comprehensive eye exam, but Dr. Thompson continued with such medical authority that Dorothy began questioning her memory. Maybe her regular optometrist had ordered specialized testing. Mrs. Mitchell, your retinal photography shows a developing tear in your left eye that will cause complete vision loss within days, if not surgically repaired immediately. This is exactly the type of sight-threatening emergency we specialize in treating. The caller knew Dorothy's age, address, and even referenced her recent complaints about vision changes during routine medical appointments. This personal information made the emergency seem credible and terrifying. I need to stress how urgent this situation is. Retinal tears progress rapidly in patients your age, and the window for successful surgical repair is extremely narrow. Without immediate intervention, you're facing permanent blindness in your left eye. Building vision fear. Dr. Thompson continued her explanation using impressive ophthalmology terminology that Dorothy found both frightening and believable. She described retinal anatomy and surgical procedures with medical fluency that seemed legitimate. You're specific. Tear pattern shows classic signs of age-related vitreous detachment with macular involvement. The retinal photography reveals fluid accumulation that indicates active separation, requiring emergency vitrectomy surgery. She explained that Dorothy's type of vision problems were exactly what led to these sight-threatening complications. Dorothy had indeed been experiencing some visual changes that she attributed to normal aging. Vision changes like yours are often the first warning signs of serious retinal pathology. Patients who dismiss these symptoms as normal aging often discover too late that they needed immediate surgical intervention. Dr. Thompson created urgency by explaining that Dorothy's age made retinal surgery more complex, and that delaying treatment even hours could result in surgical complications that would make vision restoration impossible. I've been performing emergency retinal surgery for 15 years, and your exact retinal tear pattern has a 95% success rate when repaired within 24 hours. After that, success rates drop dramatically. The emergency surgery protocol. Dr. Thompson explained that Dorothy needed emergency retinal surgery that afternoon to prevent permanent vision loss. The specialized procedure would cost $18,000, but could save her sight completely. Emergency retinal surgery requires immediate payment because we need to reserve operating room time and specialized surgical equipment. Once we complete the surgery and submit documentation to Medicare, you'll receive partial reimbursement. She provided Dorothy with specific surgical codes and ophthalmology procedure numbers that sounded official. Dr. Thompson seemed to have detailed knowledge of retinal surgery and spoke with authority about emergency eye procedures. I understand. This seems expensive, but what value do you place on your vision? This surgery will prevent the blindness that would otherwise be inevitable. Patients with your exact retinal tear who receive immediate treatment maintain normal vision. Dr. Thompson created additional pressure by explaining that her surgical schedule was completely booked, but she could arrange emergency surgery if Dorothy could confirm payment within hours. Based on your retinal tear severity, I've cleared my afternoon surgical schedule specifically for your case. This type of emergency requires immediate action, and I can't hold this surgical time without payment confirmation. The payment urgency. Dorothy felt overwhelmed by the vision loss threat and the pressure to make immediate surgical decisions. Dr. Thompson had created such convincing medical urgency that questioning the surgery seemed like accepting inevitable blindness. She agreed to the emergency surgery. Dr. Thompson guided her through the payment process, explaining that the surgical facility required wire transfer to secure her emergency operating room slot. Emergency retinal surgery requires immediate wire transfer to guarantee surgical equipment availability and anesthesia team coordination. This is standard protocol for sight-saving procedures when timing is critical. At the wire transfer location, Dorothy hesitated when asked about the payment purpose. Dr. Thompson, still on the phone, coached her to explain it was for emergency eye surgery, which sounded medically legitimate. Dorothy sent $18,000, believing she was saving her vision. Dr. Thompson assured her that surgery was scheduled for 3 p.m. that afternoon and provided pre-surgical instructions. You've made a sight-saving decision. This retinal surgery will prevent the blindness that would otherwise occur within days. The dangerous procedure. The address Dr. Thompson provided led Dorothy to a makeshift medical facility in a converted office building. The surgical center looked medical, but lacked proper ophthalmology equipment and sterile surgery environments. The people who claimed to be ophthalmologists were not qualified eye surgeons. They had Dorothy lie on a table while they performed unnecessary and dangerous procedures around her eyes using unsterilized instruments. The fake surgery involved shining bright lights directly into Dorothy's eyes and applying substances that caused immediate irritation and pain. When Dorothy expressed concern about the discomfort, the fake surgeons assured her this was normal. Some patients experience adjustment sensations as we repair the retinal tear. The laser treatment can cause temporary irritation, but this means the surgery is working. After an hour of inappropriate eye manipulation, Dorothy's vision was actually worse than before the procedure. Her eyes were red, painful, and she was experiencing new visual disturbances. The vision crisis. Dorothy's vision problems worsened significantly over the next 24 hours. Her eyes were swollen, painful, and she was seeing halos and flashing lights that hadn't existed before the fake surgery. Concerned about her deteriorating vision, Dorothy went to a legitimate emergency room. The ophthalmologist there was alarmed by the condition of Dorothy's eyes and immediately recognized signs of injury. "Mrs. Mitchell, your eyes show signs of trauma and possible chemical irritation. Whatever procedure you had was not legitimate eye surgery, and it has caused actual damage to your corneas and conjunctiva." The emergency doctor explained that Dorothy's eyes had been injured by the fake surgical procedure. The substances used and the bright light exposure had caused inflammation that could have permanent effects. There is no retinal tear in either of your eyes. Your vision was normal before this procedure. You've been the victim of a sophisticated medical scam, and the fake surgery has actually harmed your eyesight. The medical evaluation comprehensive ophthalmology examination revealed that Dorothy's original vision was completely normal for her age. There had never been any retinal tears, fluid accumulation, or need for surgical intervention. The fake surgery had caused corneal abrasions, conjunctival inflammation, and temporary vision disturbances that required actual medical treatment to prevent permanent damage. Dorothy's doctor had to prescribe antibiotic eye drops and anti-inflammatory medications to treat the injuries caused by the fraudulent surgical procedure. The irony is devastating. You had healthy eyes before this scam, And now you have real eye problems caused by criminals pretending to save your vision. The investigation medical fraud investigators explained that Dorothy had been targeted by a sophisticated operation that focused on vision fears to manipulate elderly patients into paying for unnecessary surgical procedures. The investigation revealed that the same group had scammed dozens of seniors using similar fake eye emergency scenarios. They had stolen over $900,000 while potentially causing permanent vision damage through dangerous fake surgeries. Police discovered that the scammers used fake medical credentials, makeshift surgical facilities, and detailed ophthalmology knowledge to create medical emergencies that bypassed rational decision-making. Warning signs. Dorothy missed. Looking back, Dorothy identified several red flags she wished she had recognized. Unsolicited. Calls about emergency eye conditions. Legitimate ophthalmologists never call patients about emergency retinal tears without prior examination or scheduled follow-up appointments. Immediate surgery demands with same-day payment requirements. Real eye surgery is scheduled through established medical facilities, with proper pre-surgical evaluation and insurance verification. Pressure to undergo surgery without second opinions. Legitimate eye surgeons encourage patients to seek additional consultation for major procedures, especially emergency surgeries. Wire transfer requirements for surgical procedures. Established surgical centers process payments through normal medical billing and never require wire transfers for emergency procedures. The recovery process. While Dorothy never recovered her $18,000, her eye injuries gradually healed with proper medical treatment. Her vision returned to normal, but the emotional trauma of nearly losing her sight to criminals lasted much longer. Dorothy's experience led to increased awareness about vision-related scams targeting seniors in her community. She began working with senior organizations to educate others about fake medical emergency scams. Most importantly, Dorothy learned to verify all unexpected medical communications through her established eye care providers before taking any action regarding vision concerns. Final thoughts. Dorothy's story demonstrates that vision scams are uniquely manipulative because they exploit our most precious sense. These criminals understand that seniors will do anything to preserve their sight, including paying large sums for emergency procedures. The key lesson from Dorothy's experience is this: legitimate eye emergencies are never resolved through unsolicited phone calls demanding immediate payment. Real retinal tears and vision threats are diagnosed through proper examination by established ophthalmologists. If you receive calls about emergency eye conditions, hang up and contact your regular eye care provider immediately. Never agree to emergency eye surgery based solely on phone calls, regardless of how medically urgent they sound. Remember, protecting your vision means working with qualified ophthalmologists through established medical channels, not paying scammers who exploit vision fears to perform dangerous fake surgeries. Thank you for joining us today. We'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to use it in your life. Your thoughts are important to us, so don't hesitate to share them. Reading your comments gives us great motivation and encouragement. If you enjoyed this video and found it helpful, please like, subscribe, and share. Your support helps us continue creating good content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next video.